Hello, my name is Dr. Jason Woodward with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to offer ways to accommodate audiology testing for individuals who need special assistance. Individuals with intellectual or developmental disability, also called IDD, may experience anxiety in medical encounters related to unfamiliarity with the situation or a past difficult experience. Lack of cooperation may be related to fear and can create challenges in testing some patients. First, consider how to best communicate. Verify potential differences in receptive and expressive language skills. Acknowledge accompanying caregivers and verify their roles. Key points in communication are: speak directly to the individual, explain and demonstrate. Information is easier to understand when large ideas are broken down into smaller parts. Visual tools can be helpful to aid in understanding. Speak and move slowly. Processing time is often slower for individuals with IDD. You may need to allow 15 to 20 seconds after asking a question to get a response. Use simple and comforting language. Use repetition and recap key points at the end of the conversation. Praise cooperation. Take 5 to 10 second breaks when needed. When bringing a person with IDD to the testing booth, ask if they prefer a support person to join them. Verify if the support person is there to provide emotional support or also help with physical transfers or communication or other aspects of the visit. Direct your questions to the individual unless they specify that the support person is the preferred communicator. Ask for clarification from the support person if needed. The otoscope exam can be difficult for some people. Explain the exam, ask for permission, and move slowly. Display the tool and allow the individual to touch it to ease discomfort. Sometimes demonstrating on another person can also help. Demonstrate where the individual should sit. Make accommodations if the person needs help with positioning. Some people might not be able to sit comfortably in a chair. You may need to allow the person to take a break during the exam. You may want to refer to our videos on the ear, nose, mouth exam at 4ourhealth.org. Display the headphones or earbuds. Verify if the person would prefer to assist with placement rather than letting you place them. Explain each step of the test before you leave and reassure that you will return as soon as the testing is complete. When the testing is completed, explain your findings to the patient and answer any questions. Inform them who will get the results and what to expect for follow-up after the test. Thanks for watching. To assist your patients in preparing for a hearing test, you can refer them to the partner video at 4ourhealth.org.